So hypothetically, I've got PCOS. We're really going to have to think out of the box on this one.
5 to 10% of women are affected by this. I'm not on fire.
What are the kind of the long-term consequences of not addressing PCOS?
Okay, so you're just not going to be happy. According to research, an average woman with PCOS sees 4 doctors before receiving the correct diagnosis. So they've, basically jump around, bounce around.
Where are they going? Hello and welcome to our first edition, I'm very excited by the way, of I'm not a doctor, but my wife is. My name is Gregg Parker. I'm the managing director of the Rosewood Clinic. I'm also the general dog's body and also the man that does everything and what is necessary in the clinic. I am joined today by our medical director and my dear wife and co-founder of the Rosewood Clinic, Dr. Iman Thalia.
Hi.
Thank you for joining me today.
It's a pleasure.
Or co-hosting with me, let's say.
Really?
Yes.
Yeah.
Now today we're talking about PCOS, which is
Polycystic ovarian syndrome.
Exactly. We're talking about that today. So let's just give us all a rundown about what PCOS is.
So PCOS, or polycystic ovarian syndrome, means that women have excess androgen. So in a normal woman, you would have some form of testosterone, but then in a woman with PCOS, they will have excess of that. And that can cause cyst around the ovaries.
Sounds nasty. Yeah. I mean, it sounds nasty to me, but okay. So what are the ramifications of PCOS?
Typically, women would present with irregular periods. So sometimes even missed periods, skip periods, which we call amenorrhea. Okay, so they have periods of...
Water, my love.
Oh, wow. That's so sweet.
A true gentleman. Okay.
Yeah, and so a lot of other women can have many different types of symptoms, and that could be acne, excessive hair growth, even hair fall.
You can have excess hair
Yeah.
and also fallen hair.
Yeah.
So
that's
either
right.
end of the spectrum.
Yes.
And when so fallen hair I get. When we talk about excessive hair,
Yes.
are we talking... no, I'm trying not to offend anyone when I say this.
Yeah,
Are
I
we
don't think
talking
so.
American Werewolf in London?
I don't
Are
think
we
so.
talking American Werewolf in London, kind of like hair everywhere? Are we talking full bodysuit? Or what are we doing? What are you saying?
No, but I mean, yeah, because it's actually some, like, they can have hair over the chin.
Light hair here.
Yeah, and then there's also women who can have weight gain issues. So they struggle to lose weight. They've done everything, tried so many different types of diet, exercise, but it's still not working. The weight just won't budge.
Wow. So quite
Yeah.
varied them in the kind of like in
Yeah.
terms of the symptoms. Let's talk about diagnosis. So I imagine it would be an OBGYN or a GP that would diagnose PCOS?
Yeah, so you would think that, but according to research, an average woman with PCOS sees 4 doctors before receiving the correct diagnosis. So they've, basically jump around, bounce around.
Where are they
from doctor.
going?
Yeah, exactly. So because the symptoms can vary so much, like I mentioned, right? Acne, irregular periods, excessive hair growth, weight gain issues. And so then, just like today, I've seen a patient, she had acne. She struggled with acne for 10 years. And, she's seen at least 3 dermatologists, an aesthetic doctor, a gynae as well. So she's been on a lot of medications. So typically when patients have severe cystic acne.
Cystic, what does that mean?
Yeah, so cystic acne means acne with pus.
Sounds pretty serious.
Yeah. And so usually the gold standard to treating this is Roaccutane, which is vitamin A. It's a very strong medication. There's also side effects from there. And so they have to be monitored closely. They can't take it too long, so but she has been on it for quite some time.
Sounds like to get off that.
She wanted to get off it. And she was like, you know what, can I just do something else? Do I have to keep taking these medications? Because every time I get off it, it comes back. And she's like, you know what, it's been 10 years. I just want to get to the root cause of this.
Just about to say root cause.
Yeah.
The Rosewood Clinic. little plug there.
Yeah, and so it was quite a research that she did to actually come to see me. And she said, I called a bunch of hospitals to find out where I can actually do my hormone test because she couldn't find it, and she said, maybe it could be hormonal related. I did my research, I Googled, and I found out that, I have a lot of the symptoms that I was dealing with. And at this point, she was dealing with a lot of gut issues. So every time she would have these kind of like flare-ups, she would be given antibiotics, which is also another way of treating cystic acne as well. So she was on these antibiotics many, many times. And she's like, okay, this is it. I kind of want to look into what can actually cause or solve this. And so she came to me and I diagnosed her with PCOS. She has PCOS. That's actually the cause of her acne.
Okay, I get back to the core part here. These days, men and women, we're much better at Googling.
Yeah.
We're savvy. We can't self-diagnose, but it does point us in the right direction. If she hadn't Googled it, she may not have found you in the first place, right?
Yeah, that's true.
Or at least narrowed it down to what she thinks the condition could be.
Yeah.
And so how long will it take her now to get to where she wants to be?
Okay, so, if we're talking treatment-wise, it's different in terms of what is the conventional practice in functional medicine, because we practice functional medicine, right? So it's a little bit different. And so we're talking about holistic treatments, and that would be anything from, diet, nutrition, stress, sleep, and
Quite holistic.
yeah, and gut health as well.
What are the treatments for this? Give me an idea of, because I imagine there's kind of conventional treatments. I imagine there's kind of like a bit more kind of holistic, maybe perhaps functional medicine. And also, I read as well, lifestyle interventions, like you've just mentioned earlier on, are crucial.
That, like what we are doing in the clinic?
Yeah,
or what we
what's
could
the
do
options for anyone out there who thinks they may have PCOS or has a diagnosis, they've got PCOS, but they perhaps haven't started addressing it yet?
Yeah, okay. So with PCOS, we're looking into what actually causes those hormone imbalances, right, in the first place. And so that is excess androgen. It could be also low progesterone. So that's another thing that we look into. So hormone imbalances, addressing all of that. And then, supplementing things like, which is magnesium, vitamin D, omega-3. A lot of that helps, with hormone health, optimizing hormones, and also looking into gut health, what's causing the gut dysbiosis.
So this, I know that, correct me if I'm wrong, but traditionally a blood test between, day 19 and 21 is a good window for determining a woman's hormones.
Yeah.
Okay, so I guess a blood test is one way of looking at it. I know that you can go into like Dutch tests and slightly more complicated tests as well, but I guess gold standard to some extent in Malaysia would be a hormonal blood test.
Yeah, to diagnose PCOS, you need 2 out of 3 criteria, and that would be, looking into some hormone tests as well, FSH and LH, also looking into testosterone, right? And then also ultrasound. An ultrasound is necessary as well.
You know that?
We're looking into other holistic things that we could also address. And that would be other things like, inflammation. But there's a lot of research on inflammation and insulin resistance.
So hypothetically, I've got PCOS. We're really going to have to think out of the box on this one.
Okay, so if a woman presents with irregular periods, and they would be put on birth control pills, this is the conventional approach. Medications could be typically, like metformin. So some women who present with PCOS can also have insulin resistance. Yeah, and so then that's why women with PCOS has risks for developing diabetes as well, or even heart issues or hypertension. In a functional medicine approach, what we do is we emphasize on a low glycemic index diet, okay? And also cut down all of that sugar, which can fuel a lot of inflammation, which can cause more hormone imbalances, cutting down processed food. Yeah.
The things which we should be doing anyway, right? Really important. So intervention number 1 is food, diet, nutrition.
Yes.
Cut the crap out, right?
Yeah,
Eat
exactly.
a clean, healthy diet.
Also focusing on anti-inflammatory food. Because there's this whole inflammation aspect of PCOS. We focus on natural supplements like inositol, omega-3, magnesium, vitamin D3. These are really important for hormone balance. So it helps optimizing.
You need, right?
So research on both PCOS and endometriosis has been limited, but it's improving. There's a recent study in 2019 which highlighted, the multidisciplinary approach when it comes to managing PCOS, and that includes, lifestyle changes, also mental health support, which is very important. That's a big factor in terms
Like
of
that.
PCOS, because they can have really bad PMS, like a lot of mental health issues like anxiety, depression as well.
So like
it's-
stress, anxiety, depression,
Yes,
key
yeah.
factors as well.
Yeah.
Okay. Now, before I wrap this one up, what are the kind of the long-term consequences of not addressing PCOS?
Okay, so you're just not going to be happy.
So we're talking here quality of life, aren't we?
Yeah.
We're talking quality of life, which could be, through
Yeah.
acne. It could be through, a pretty much a poor lifestyle as well.
Yeah.
But I assume, and correct me if I'm wrong here, I assume that there are millions of women
Yeah.
walking around out there with undiagnosed
Yeah.
PCOS, living with the symptoms every single day,
Yeah,
and don't
exactly.
even know they've got
Yeah.
the PCOS in the first place.
Yes, but now there's a lot more awareness, which is great, and this is why we're doing this. We want to create more awareness. It's also something that women should also talk about with other women, because when typically when I see a lot of patients of mine, they keep thinking that, okay, I thought this is normal. I thought these are normal symptoms, and I said, just because it's common, it's not normal. Yeah.
I like that line.
Yeah.
You should use that more often. That's true. But it's true. Dr.
Yeah.
Mantalia, thank you so much for joining me today. My co-host, I'm Gregg Parker. This is Dr. Mantalia. And you've been listening to I'm Not a Doctor, but My Wife Is. Thank you very much.